Hello everyone, welcome back to this channel. Today we'll discuss some of the model MCQs that these MCQs that may come in nursing exams or in some nursing competitive exams. The first question is, the feeling of internal organs by the hands is called option A, auscultation, option B, palpation, option C, manipulation, option D, observation. So the correct answer is palpation. Auscultation means when we listen to the internal organs like the heart sound, lungs, the lung sounds, etc. with the help of stethoscope. That is called auscultation. And palpation is when we examine, when we feel the internal organs with our hands. That is called palpation. Question number 2. Cessation of breathing for a short period is called option A, dyspnea, option B, orthopnea, option C, apnea, option D, bradypnea. So the correct option here is apnea. Apnea is when there is cessation of breath for a short period of time. And dyspnea, what is meaning of this dyspnea? Dyspnea means shortness of breath. And orthopnea, it's breathing discomfort when lying down flat, or sometimes there is called PND. It's paroxysmal nocturnal dyspnea, or sometimes it's called paroxysmal nocturnal dyspnea. In this case, the person have shortness of breathing, like when the patient sleeps, after like for 1 or 2 hours patient sleeps, he used to have this shortness of breath, and that shortness of breath is called PND, or paroxysmal nocturnal dyspnea. And what is bradypnea? Bradypnea is when the rate of respiration, rate of taking breath is less than the normal, is called bradypnea. Question number 3. To assess the popliteal pulse, the nurse palpates option A, behind the knee, option B, the side of the head, option C, the wrist, option D, side of the neck. The correct option here is option A, which is behind the knee. When we palpate, when we assess the pulse behind the knee, it's called popliteal pulse. And there are many points or places which we can palpate the pulse. It's like for radial artery, we use in the wrist, and for carotid artery, we palpate at the side of the neck, and for brachial artery, we palpate at the medial border of the humerus, and popliteal artery behind the knee. And then we sometimes palpate for dorsalis pedis and posterior tibia also. And with stethoscope, we can auscultate this abdominal aorta also, abdominal pulse. Question number 4. The term auscultation refers to option A, deep rapid breathing, option B, wheezing, option C, listening, option D, feeling. So the term auscultation refers to listening. When we say auscultation, usually we use a stethoscope to feel to listen to the sound of internal organs, like the heart sounds or the lung sounds. Question number 5. Extravasation refers to option A, leakage of fluids into tissues, option B, venous congestion, option C, inflammation of the venous system, option D, lungs infection. The correct option here is option A. Sometimes when we put cannula, and the cannula it's not in position, so when we give the injections, that leads to the accidental leakage of these medications outside the veins into the surrounding tissue. So that condition is called extravasation. Questions number 6. Where is the antecubital fossa located? Option A, depression in the bend of the knee, option B, depression in the scalp, option C, depression in the bend of at the bend of elbow, option D, none of the above. So the correct option here is option C, which is at the bend of the elbow. It is a depression at the bend of the elbow. So I'll show you this picture. So this area which is round is called antecubital fossa. Question number 7. The tip position of a PICC line is usually confirmed by option A, palpation of the lungs, option B, auscultation of the lungs, option C, CT scan, option D, X-ray. The correct option here is option D, which is X-ray. After the insertion of PICC line, usually they send X-ray for confirmation of the position of the PICC line. PICC line, the full form of PICC line is peripherally inserted central catheter. This is the full form of PICC line, and it's after the insertion of PICC line. Usually when they insert it, they insert at the the veins at the antecubital fossa. So they insert it, and then after insertion they confirm the position with X-ray. So I'll show you the X-ray. This X-ray we can see here, this one is the PICC line, and it goes here like this till here, till the heart. So this confirms the position of the line, whether it's in position or not. Question number 8. Crystalloid refers to option A, a solution that can diffuse through a semi-permeable membrane. Option B, a solution that cannot diffuse through a semi-permeable membrane. Option C, another word for water. Option D, normal salines. The correct option here is option A. Crystalloids are the solutions that can diffuse through a semi-permeable membranes, and normal saline is just an example of a crystalloid. The correct option here is option A. The question number 9. Midway through a blood transfusion, a patient complains of severe back pain. What should the nurse do? Option A, reassure the patient. Option B, stop the transfusion and take vital signs. Inform the nurse in charge. Option C, speed up the transfusion. Option D, administer analgesia. The correct option here is option B, stop the transfusion and take vital signs and inform the nurse in charge. Whenever the patient complains during blood transfusion, we should always stop the transfusion, the blood transfusion first. Why? Because if the patient complains, patient complaints is due to the reaction from blood transfusion, then by stopping this transfusion, we are preventing further blood transfusion reaction. And we should always take vital signs before blood transfusion so that we know the baseline data of the patients. And if the patient complains of anything during blood transfusion, then we should stop the blood transfusion immediately and take the vital signs of the patient again, so that we know if there is any changes in the vital signs of the patient or not. And if there is changes in vital signs, that means the patient have some blood transfusion reaction, and then we have to inform senior or nurses in charge, or if there is doctor on duty, then we can inform the doctor on duty directly. Question number 10. An autologous blood transfusion refers to option A, blood that has been screened. Option B, blood that is taken from the patient for their own transfusion. Option C, blood that is taken from the patient's blood relative. Option D, blood that is donated through the blood transfusion service. The correct option here is option B, which is blood is taken from that patient, and then they later transfuse it to that patient only. Here the donor and recipient is same.